All right, everyone. Hello. My name is Dr. Vora. I'm a first-year pharmacology student, and I welcome you all here at Know Your Calling, where we help students unleash their true potential and help them match with their perfect branch. If you are as excited as me, type in E if you are excited, because now I have this absolute honor of connecting with uh, a teacher who needs no introduction, who has made us all fall in love with pathology, and who is respected by students across India. None other than Vandana Puri Madam, who is Associate Professor at LHMC Delhi. A heartwarming welcome to you, ma'am.
Thank you so much, Swet. It has been a real honor, and thanks for inviting me. And I hope everybody connects with me when I say कि बच्चा लोग समझ आया कि नहीं आया. So that's one thing which I always love to ask after every topic. I still remember yesterday I had a lecture in my college, and I asked students कि कुछ समझ में भी आ रहा है कि सो रहे हो सुबह की क्लास में. सर नहीं मैम हम सुन रहे हैं, सो नहीं रहे हैं. So that's an absolute pleasure. Teaching is one thing which always gives me so much pleasure, and I love teaching. That's one thing I would always say कि मुझे अच्छा लगता है जब मैं कुछ चीज ऐसे समझा सकती हूँ कि बच्चों के दिमाग में वो हमेशा के लिए रहे, उनको रट्टा ना मारना पड़े. पैथोलॉजी ऐसा ना बोलना पड़े मैम पैथोलॉजी से बकवास ब्रांच कोई नहीं है. वो सुनना बहुत दर्दनीय है. That feels actually pain in the heart if they say ma'am pathology is very tough. I would love to make them fall in love with pathology, I think.
Yeah, ma'am. That's what makes it easy for us to understand the subject as well. Yeah. Yeah. So, ma'am, and students, let me tell you, I'll try to accommodate your doubts as we proceed the session. And if still any doubts are left, we'll keep it towards the end, right? Okay. So, ma'am, can you give a general introduction about pathology as a branch?
See, as a branch, what happens is that during an intern, we basically are attracted to those branches which we, work in internship. So, unfortunately, pathology, radiology are some branches in which we don't get much exposure during our internship time because we don't work there, we don't get postings there. So, that is why, as a subject, students really found difficult to connect with these subjects. Radiology, because most of the top rankers take radiology, so people say, okay, chalo, I have to take radiology. But unfortunately, since we have not worked with those subjects during our internship, it is very difficult to connect with them. So
Right.
So that's the problem. So pathology, I remember 20 years down the lane, if I talk about it, it was one of the subject which people used to say कि technicians बनना है क्या, क्यों pathology ले रहे हो. Even when I was going to take pathology, my dad was like, come on, तू pathology क्यों ले रही है, तेरा रैंक इतना अच्छा आया है, क्या करना है pathology लेके, क्या कुछ उसका scope नहीं है. So my dad wanted me to take gynae. That नहीं gynae ही लेना है, pathology क्यों लेना है, नहीं लेना है. So I was like नहीं dad, I think I love pathology and I should take pathology. तो my dad said कुछ कर नहीं पाएगी life में, pathology लेके क्या करेगी life में, you will not be able to reach anywhere. I said ठीक है पापा try करते हैं, I want to do that, let me do that and let's see what happens, what's in future with me. Let me take this decision for myself and let's see what I can do. Now, problem with this, when I was taking pathology as a branch, I myself didn't knew what pathology had for me because I was not having an exposure of pathology during my internship time. So the first day I entered into this department, I did my pathology also from Lady Hardinge Medical College. And that first day when I entered into this department, okay, so I was like, मुझे पता नहीं था कि मुझे करना क्या है. I didn't even knew that what I'm going to do in this department and what is the scope of work of pathology. So everybody, as I entered into the department, people are telling me, okay, do you know what is pathology? And I said, नहीं मुझे कुछ पता नहीं है, करना क्या होता है यहाँ, करना क्या है. So slowly, when I entered, I came to know that there are a lot of sub branches of pathology, like hematopathology, cytopathology, histopathology, immunology, again blood banking. All these are part of pathology, and slowly, when I started getting postings in each of them, I started, started to understand that what do pathologists do. So pathologists, basically, I should say, they're doctors. So they interact with doctors basically. जो केस क्लिनिशियन आप देख रहा है, उसका फाइनल डायग्नोसिस पैथोलॉजिस्ट ही बनाता है. So until and unless you have a good pathologist in your institute, you would not be able to make your diagnosis well. So in a way, it has drastically changed over 20 years, क्योंकि पहले इतनी डायग्नोस्टिक मोडालिटीज थी नहीं, बट नाउ विद एवरीथिंग बिकमिंग मॉलिक्यूलर, हर डायग्नोसिस आप कुछ भी ले लो, कोई भी न्यू WHO क्लासिफिकेशन ले लो, कुछ भी ले लो, द फाइनल डायग्नोसिस इज बाय पैथोलॉजी एंड द मॉलिक्यूलर डायग्नोसिस. Now the scope of pathology has increased like anything, and it will increase only. If you look at the Western world, definitely when we talk about India, we are 10 years back in the Western world in the terms of diagnostic modalities. So if you look at there, the pathology goes in very top rank. So if you are clearing your USMLE and you want to take pathology, you have to really have a very good rank to enter into pathology there. I think within the 10 years, you're going to see the changes again here. Molecular techniques are advancing like anything. हर चीज, हर टेस्ट पे NGS है. Next generation sequencing के बिना diagnosis है ही नहीं. So until unless you do that, you advance like that, you are not able to reach up to your Western counterparts. और वो बढ़ना ही है. Ultimately, जो भी हम लोग कर रहे हैं, we are going to we have a standard to follow. We have a WHO guidelines to follow. We have to reach there. So ultimately, you have to reach that standard. पहुंचोगे ही. So these branches are going to reach ahead of everything, because they are the diagnostic modalities, they are the final diagnostic terms. So that is what I would like to say, ki yes, pathology was considered as an underdog, I would say 20 years back, but now it is one of the forerunners. Though in our country अभी भी छोटी cities में जाओगे तो pathology का इतना scope नहीं लगता है, but if you come to the most developed capitals of the country, बिना diagnostic modalities के, there is no diagnosis, you can't start the therapy on it. I'll tell you a case also if we have time afterwards, that how I understood the scope of pathology when I was doing my senior residency more.
Right. So I think with all these diagnostic modalities coming and next gen sequencing coming up, pathology has assumed a pivotal position these days, right? So yeah. So ma'am, how do you expect the 3 years of residency to be, ma'am?
Okay. Expect means, see, a 3-year residency of pathology is actually from wherever you do. Now there is a world of digital media, so you can't say कि मेरे कॉलेज में तो पढ़ाई अच्छी होती नहीं है, या मेरे कॉलेज में तो केसेस अच्छे हैं नहीं. There are so many CME sessions which are going on all over the country. To name a few, the Tata Memorial Hospital has opened up a very good platform of online teaching for postgraduates, जिसमें कि every week they basically put up some cases and they discuss the cases. So as a first year postgraduate, when you enter into the college, okay, the first thing that you should do is orient yourself to the department. Don't be in a hurry ki I have to learn everything in the first year itself. Just orient yourself, and if you're posted in histopath, just look at the Vita's textbook of histopathology and look at the basics कि कैसे दिखता है, because as an intern we don't know. As a second year undergraduate जब होते हैं तो भी हम slides को ऐसे ही देखते हैं कि exam pass करने के लिए देख रहे हैं. But when you reach there, just look at the basic histology and understand कि अच्छा, how does the basic structures look. So basic histopath, cytopath, when you go to cytopath, learn the basic techniques like FNAC कैसे करते हैं, अच्छी FNAC कैसे की जाती है, एक अच्छी true cut biopsy कैसे की जाती है. So learn the basic techniques in the first year, okay, and how to do it properly, and look at the basic cell structure. अच्छा, ये cell ऐसा दिखता है, ये benign cell है, ये malignant cell है. When you go to hematopathology, look at the basic thing, okay, look at the basic machines that they have. अच्छा, ये coulter है, ये cells को count करता है, ये coagulation के लिए है. So basic techniques and basic cells. अच्छा, इसको DLC में ऐसा cell neutrophil ऐसा दिखता है, monocyte ऐसा दिखता है. So for histopath, Vitas is the textbook that every first year should go through. Okay, for cytopathology, oral textbook is one book which you should start reading from the first year. For hematopath, Desi is one textbook which every postgraduate, as soon as he enters, should start reading the first basics of it. So these are some standard textbooks that you do. When you go to immunology, immunohistochemistry is the first technique that you'll come across. You have already started in your NEET PG entrance and all that. Start looking at it. Okay, ये न्यूक्लियर स्टेन है, ये साइटोप्लाज्मिक स्टेन है, इसको हम ऐसे करते हैं, ऐसा बफर यूज करते हैं, तब टेक्निक आती है. Expertise on the techniques. So when I joined Lady Hardinge, one of the things that my head of the department used to say always is कि हार्डिंग के बच्चों की खासियत पता क्या है कि वो जीरो से स्टार्ट करके लैब एस्टैब्लिश कर सकते हैं. सो ईच एंड एवरी टेक्निक, डोंट थिंक ये टेक्निक तो टेक्नीशियन करेगा, हम नहीं करेंगे. You should, if you don't know how to do it, you can't guide technician that they are not doing it correctly. So you should be able to troubleshoot everything. कि अगर उसका स्टेन नहीं आ रहा है, वो कह रहा है मैडम हमारा तो स्टेन नहीं आ रहा, but if you have not done it, you can't say कि कैसे करना है. Then you can pick up the mistake. अरे तुमने तो ये ठीक से नहीं किया, तुमने तो ये करा नहीं. And in the world of medical college, only knowledge is the master. That is what I will always tell to everybody. In a world of medical college, knowledge is the master. If you are more knowledgeable, people will respect you more. Or if you're not knowledgeable, if you don't know your subject, okay, people will not respect you. People will say कि इसको तो खुद ही नहीं आता, इससे क्या पूछना. So learn the subject very well. So start from basics in the first year, and then of course in third year, master your theory, master your subject well. Okay, then you should be able to correlate everything. Okay, first year is for techniques and basics, and by the time you reach third year, you should be knowing your subject. मैं ये नहीं बोलती कि you should know 100% of your subject, okay, because once you've taken that branch, it is just the beginning of the journey. Okay, the journey is going to go on for life. So you will keep learning this subject more and more with time. Okay, हो सकता है आपने जो post graduate में देखा, senior residency में you will learn more about it. Okay, and then more and more and more. Even I am learning. कितनी चीजें हैं जो मुझे भी नहीं आती हैं और मुझे भी मेरे रेसिडेंट आके बताते हैं कि मैम ये पता है ऐसे होता है. मैं ऐसे अच्छा ठीक है, very nice, I learned this point today. So don't think that you should know everything by the end of your residency. You should learn most of your subject, and even if you don't know many things, you will learn because this is your subject. Only one thing I will tell: by the end of the residency, you should love your subject. If you don't love your subject by the end of the residency, that subject is not for you.
Right, ma'am. Ma'am, what if somebody has a difficult time with the stains, but is in love with the subject? So what's your take on that, if he or she wants to pursue?
Difficult time with stains. Yeah, देखो, stains are not a very small part of pathology. Stains are not a very big part of pathology. They are small part in a sense that they are very easy to put. There is a SOP for every for every stain. There's a standard operating guidelines. It is already told to be every lab, every college has already standardized a set of stains. इसको ऐसा ही करना है. If you're following that SOP, stains will never be a problem. अगर कोई बोल रहा है कि भाई आपको ये stain डालकर 30 minutes रखना है और फिर इसको ऐसे wash कर देना है, अगर आप उसको 30 minutes रख के wash कर दोगे, stain आना ही आना है. So anything, I'll tell you an example. If you're looking at a case of APML, okay, acute promyelocytic leukemia, if you're looking at a case and you're putting it, you want to put MPO stain in it, okay? MPO, आप अगर थोड़ा बहुत भी SOP को follow करते हो ना, APML cells are attracted to MPO, so they'll catch up MPO like anything. आप थोड़ा देर भी डालोगे, थोड़ा सा भी SOP ठीक से follow करोगे, all the cells will brighten up with MPO. So it is not like कि आप you have to do something very there should be some high tech knowledge to understand stains. Cells खुद ही उस stain को बहुत प्यार करते हैं, तो अगर वो positive है तो आना ही आना है. आपको सिर्फ थोड़ा सा अपना SOP पढ़ना है कि मुझे कैसे stain लगाना है. That's it. It's not a very high robotic science. It's very easy actually.
Right. So wonderfully put. This I think should answer the resident's question. Okay. So now, ma'am, what is something that you have always loved about this branch?
I have always loved कि जो कोई diagnosis नहीं बना पाता, वो तुम बनाते हो. That is one thing I love about it. So I remember this child, there was a 6 months old child who had this anemia, persistent anemia, and he was requiring transfusions. ठीक है, और उसको ट्रांसफ्यूजन रिक्वायरमेंट थी, लेकिन फैमिली में कोई ट्रांसफ्यूजन की हिस्ट्री नहीं थी, ना फादर को, ना मदर को, ना सिबलिंग्स को. एंड एज ऑलवेज उसको बार बार ट्रांसफ्यूजन चाहिए होता था. एंड एज ऑलवेज इन आवर कंट्री हम लोग सोचते हैं कि थैलेसीमिया इज द फर्स्ट डायग्नोसिस. 6 महीने 7 महीने का बच्चा है आपके पास, ट्रांसफ्यूजन रिक्वायरमेंट के साथ आ रहा है, थैल मेजर ही होगा. So again the clinicians thought that it is a thal major, and they sent the case peripheral smear for evaluation. Peripheral smear of thalassemia major is very characteristic. If you see it once, you'll never miss it. As a resident, okay, NRVCs होते हैं बहुत सारे, बहुत अनाइसोपोइकिलोसाइटोसिस होता है, एकदम से देख के पता चल जाता है कि ये थैल मेजर है. ऐसा कुछ भी नहीं था उसके स्मेयर में, ठीक है. स्मेयर बिल्कुल नॉर्मल सा था, थोड़ा सा मैक्रोसाइटोसिस और कुछ भी नहीं. And everybody was like कि क्या है फिर ये, what to do. So then by that time you said कि अब तो bone marrow करनी पड़ेगी इस बच्चे की. It is very difficult to do a bone marrow for छोटा बच्चा, especially 6-7 months का बच्चा आ रहा है तुम्हारे पास, and the pathologist has said, clinician was thinking of thal, and आपने बोला नहीं नहीं थैल तो नहीं है, कुछ और है ये, आप इसकी मैरो करके भेजिए. ठीक है. तो when the marrow came to us, and it was like such beautiful CDA, okay, it was congenital dyserythropoietic anemia था उस बच्चे का, and it was so beautiful cells were seen there, and we showed it to the clinician also. So that's the one of the very good things which has started now, which is called CPC, that is clinico-pathological meets जो होती हैं. तो आप उनको बुला के दिखाते हो कि देखो ये cells कैसे लग रहे हैं, and they were also like very happy to see that they were able to make a diagnosis of CDA. And of course then we send it for the genetic sequencing कि भाई father mother में कुछ है तो नहीं, कोई ऐसा तो नहीं, what is the gene involvement and all that. So that case was diagnosed as CDA. So thing is कि whenever any clinician is in diagnostic dilemma कि ये क्या हो सकता है, डायग्नोसिस नहीं बन रहा. सिमिलरली GI में मैल एब्जॉर्प्शन हो रही है, कितने सारे कारण हो सकते हैं मैल एब्जॉर्प्शन के, यू डोंट इवन नो. बट व्हेन दे डू अ बायोप्सी एंड यू सी जियार्डिया इन इट, and you say कि अच्छा इसमें तो giardia था, तो then it is like one diagnosis which makes the life of clinicians also better कि okay diagnosis बन गया है. What if there is no pathologist? You will never be able to make a diagnosis कि क्या diagnosis था. You will be like round and round and round that we are stuck. So that's one thing which I love about the branch. It's like a puzzle. I always feel it like a quiz or like a puzzle कि जब कुछ नहीं बन रहा है तो क्या हो सकता है, क्या हो सकता है, क्या हो सकता है, आप सोचते रहते हो, पढ़ते रहते हो, and finally you come to the diagnosis. So that's one thing which I love about this branch.
Right. So basically pathology comes into picture when others have already raised their hands, and it is the inquisitiveness of the pathologist which drives him to come to better conclusions.
Definitely.
Right. So ma'am, something about the pros and cons of this subject.
कौन तो जरूर पूछना चाहते हैं सब लोग, because there is so much query that I get every time that what are the cons of this branch. देखो यार, people always most of the students message me and say मैम ये बहुत saturated branch है. मुझे बोलते हैं लोग कि saturated branch है, लें कि ना लें. So first thing I want to ask is saturation. I would say saturation is what? You don't get jobs after this. That's the saturation, isn't it? मैं ये जानना चाहती हूँ कि क्या कोई अगर ENT करके आता है तो उसको एकदम से जॉब मिल जाती है क्या, या ऑफ्थैल्मोलॉजिस्ट होता है उसको एकदम से जॉब मिल जाती है. सो definitely I would say whenever we as a doctors are the bad part of pathology is because we are not dealing with the patient directly. So that is why patient doesn't know us. Okay, so therefore people usually have to rely on the jobs, है ना. ophthalmology या ENT की सबसे अच्छी बात ये है कि they can open their own setups. Okay, and they can say ठीक है यार नहीं मिल रही जॉब, कोई बात नहीं, I'll open my own setup instead. Pathology में ऐसा करने के लिए you need to have lot of funding. Okay, because you need to have lot of money to put up that machines, that setup and all that. मतलब one thing is कि you can do that in smaller centers. There is a lot of companies which are now doing rentals. Okay, जो कि आपको rent पे machines दे देते हैं, and then you have to just pay them the rent of that machine. That is one thing which people can do. But otherwise, as a job, if you look, yes, pathology job opportunities are less because majority of the time जो भी हॉस्पिटल होता है, कहीं पे भी हॉस्पिटल होता है, he needs a pathologist, okay, and usually they would prefer to have a senior pathologist with more experience, okay. So as a fresher, you find difficulty to enter into a new setup, okay. So that is definitely there. Job थोड़ी मुश्किल से मिलती है, but I always think that then there are a lot of other options also which pathologists have. Not only that you have to do a job with a corporate or a lab only, you can also start your job as a teacher in a medical college, because pathologists are required in the according to the NMC curriculum also. So you can, there are a lot of private medical colleges and government medical colleges which are coming up. You can definitely complete your um, always do your residency and complete your senior residency for your experience, and then you can join as an assistant professor in a medical college. That also you can do. Apart from that, there are a lot of research opportunities which are also there for the pathology people, or super specialization. You can do, any pathologist can pursue a DM hematopathology, or he can do DM in histopathology, okay. So, and also there are a lot of PTCCs, okay, so that is post degree certificate courses in every subject we have, in kidney, in liver, okay. So there are a lot of good institutes which do PDCCs, and then you become specialist of that subject, okay, like a liver pathologist, like a kidney pathologist. And then definitely a specialized hospitals which are like kidney hospitals love to hire only people who are kidney pathologists, okay. Like institute, if you talk about institutes who are expert, who are doing liver transplants, would like to take liver hepatopathologists. So that is, again, you can extend your horizons. And obviously, and the last thing, obviously you can open your own lab. Most of the people who actually take risk, like Lal Pathology lab, they become, multimillionaires also. They are the unicorns of the country. So you never know, you can become the next unicorn of the country. You start your lab and then you become a unicorn later on. In future we'll say, okay, I was a pathologist, yeah, I took risk and I opened the lab. So that all can be there. That
Right,
is gone.
right. Okay, so ma'am, what are the scopes in research field in India as well as abroad?
Okay. So research, when we talk about it, India gives a lot of research opportunities, but job opportunities are very less, because we don't have much of the scientists post here. There are scientists post here, which are present in the premier institutes, like AIMS Delhi, PGI. They have scientists post there, but in other hospitals, scientist posts are not there. So basically, you can do two things. You can either do a PhD in a subject, in a topic which you want to do, but there you will be competing with the other PhDs also. So you can do PhD and you can then apply for a job like a scientist in the country, in India. Or you can, in abroad also, you can apply for a lot of research opportunities. Like there are courses of uh, I can tell you a few of the courses. Like in Finland, there is a course in which they do a GWAS sequencing, that is genome wide association studies. And if you do take that project, genome wide association studies, they give you a project to work on, and later on they usually they can absorb you in some position like a project. So like that, there are specialized things in which you can do that, like genome wide association studies or next generation sequencing. The small things you can do your specialization on, and you can enter into the projects.
Right. Ma'am, this takes me to this particular question which many have asked. Ma'am, DM clinical, like you told, DM clinical hematology, that also would be a door for medicine people, as well as I think pedia people. So, what's your take on this?
Actually, clinical hemat was open for pathologists earlier. I don't know this time they have opened it or not. But they were not in favor of taking pathologists in a clinical hematology positions. Reason for that was that, see, we have not done a ward posting since a lot of years now, like 6 years. If we do if we talk about a post graduation and senior residency, we have not done a ward postings and looking at the patient. Obviously we have the knowledge of the subject, but word postings and all that is less. That is why they were little resistant or hesitant to take pathology residents in the clinical hematology postings. So they were never present in the premier institute. If you talk about the AIMS and PGI, they were never taking this pathology people in the clinical hematology posting. But NEET super specialization was giving clinical hematology specialization to the pathologists. So I always feel, whoever asks me, I don't know I'm right or not. See, if once you've chosen a pathology as a subject, and if you're in love with pathology, that means you are in love with slides, you are in love with pathology. Okay, you are not in love with uh, patients, looking at the patients and looking at the cases and all that. So by the end of your pathology, you have dedicated your life for 3 to 6 years in pathology, and suddenly you change your life and change into a clinician. You can do it, but if you are in love with the subject, you would not like to do it because you never wanted to become a clinician. That is why you took pathology, right? If you wanted to become a clinician, you could have taken medicine or you have taken pediatrics. So it's like it's like I say I don't like pizza and burger. I don't like pizza and burger. Okay, and by the end of 6 years, I say I just want to eat pizza and burger only. So it's like that only, no. So it's personal choice of a person what he wants to do basically. So yes, NEET super specialization was giving a clinical hematology posting to the pathologists, but I don't know what is the future of this. Is it going to stay or not? I am not sure about it.
Right. Ma'am, can you elaborate on the fellowships available after pathology?
Yes.
And you, like you said, post degree certificate courses.
So there are a lot of course, if we talk about, there is an Institute of Liver and Biliary Sciences in Delhi. It gives you PDCCs in hepatopathology. Okay, it specializes you in liver. Kidney pathology PDCC is present in various locations. Okay, so if you just put PDCC kidney, you'll get so many hospitals which are giving you PDCCs in kidney pathology. Nowadays, even DM histopathology, PGI Chandigarh is doing DM histopathology. AIMS New Delhi and PGI are doing DM hematopathology. Okay, if you look at CMC Vellore, it is one of the very very good institutes for hematology fellowships, and also molecular fellowship. One of the best molecular fellowships of the country is with CMC Vellore. It gives you very beautiful molecular fellowship. When even people who do finish their DM, after that they go to CMC Vellore to get themselves trained in that molecular techniques. So there's a lot of scope. It's not that you don't have scope after this. You have to just search for the right avenues and start working towards it.
Right. Ma'am, coming back to is always age-old question of MD versus DNB pathology. What's your take on this, ma'am? MD in government and private institute versus DNB pathology.
Okay. So this is one question which I have been asked like about million times. Okay. So I will only say one point about it. See, there are two things only. One is your pass percentage. Okay. See, you cannot expect a resident to know everything by the end of the residency. Okay. So if you're saying that by end of 3 years I will know everything about pathology, it's not possible. It's not humanly possible to do that. So whenever we give exams, basically for MD exams or DNB exams, we try to make give slides or questions which is of the level of a resident.
Correct.
So in cases of MD, the pass percentage is like I would say 95%. Okay, 95% pass percentage is there. DNB still has a little less pass percentage. Okay, so they are little more stringent. So that is one thing, that pass percentage has to be taken into
Okay.
account. Second point is when you work in as a MD resident in a government medical college, okay, you get a holistic training, not only of seeing these slides, but also teaching the undergraduates and the postgraduates, or if you are senior resident, postgraduates, or just if you're postgraduate, teaching undergraduates. So you not only become a lab person, you also become a teacher. You learn how to teach. Okay, how to interact with an undergraduate, so you teach also. Third, you see a lot of teachers or a lot of seniors, they're doing a lot of research. Okay, so thesis is going on. You also have to do thesis, but apart from that, there are a lot of projects going on in a medical college. ICMR projects are going on. So you learn basically how to write a project. How can I write a project and present it later, or I can put it up. So you learn to do that also. Okay, so it's a holistic thing. So if you're doing a DNB in a very good institute, let's say in Gangaram Hospital is one of the very good hospitals. So you will get all these exposures. You will, apart from, they have the teaching programs also. They have their very good lab setup, very good patient load, and research also is going on there. So if you join DNB in such good institutes, okay, which are very good, which will give you a holistic approach of everything, then yes, DNB is equivalent to MD. But if you want to join a DNB in an institute which is very privatized hospital like, then I would say better not join there, because if you join in that center, which is a very privatized place, they also need working hands basically. So it should not be that as a DNB resident you just become a working hand, and at the end of 3 years you feel like, यार मैंने कुछ सीखा ही नहीं, मैं तो काम ही करता रह गया. So it should not be that. As a resident, the work of resident is not only to just do the work of the hospital. The other work is that you have to learn also. You should get ample time of learning, understanding how to teach, and also doing a research. So all these are very important, because you also at the end of 3 years should have a curriculum, should have your CV to present. Okay, so you should have your CV, a good CV, that okay, I have 2 research publications, at least that's mandatory na, 2 research publications to honi hi chahiye. By the end of your residency you should have at least 2 research publications. You should have, good exposure to the teaching undergraduates. You should have good lab exposure. So by the end of 3 years you should feel कि हाँ मैंने सब कुछ किया, मैंने टीचिंग भी करी, मैंने रिसर्च भी करा, मैंने पढ़ाई भी करी, मैंने काम भी किया. बट इफ इन इंस्टीट्यूट यू जॉइन जहां सिर्फ काम कर रहे हो, जहां बाकी कुछ नहीं कर रहे हो, जहां आपको कोई एक्सपोजर नहीं है, then it is no worth of joining that place. So decide, very carefully. Yes, DNB and MD are equivalent, but only thing is decide where you're joining. The institute is very, very important.
Right. I'm sure this will answer all the questions of these budding pathologists who have recently done with NEET PG. So I want to ask about this new branch about lab medicine.
Yeah. So that is one question again, which is very frequently asked. The origin of lab medicine basically came from a field like clinical pathology. So they wanted to make a branch which is actually a starting branch of any hospital. That is, it combines clinical biochemistry, clinical microbiology, and clinical pathology. All 3 have to be combined. When they combined all these 3, okay, a person who is trained enough to see all the reports of clinical microbiology, clinical pathology, and clinical biochemistry. Then they made this lab medicine. Earlier, what used to happen is they used to, every institute required 3 people, a microbiologist, a biochemistry person, and a pathologist, to look at the preliminary reports, okay, of the person coming into the hospital. So they combined all these 3 and they made कि ठीक है, एक ऐसे branch बनाते हैं जिसमें कि तीनों इकट्ठे होंगे. क्लिनिकल बायोकेमिस्ट्री भी करेगा बंदा, क्लिनिकल हिमैट, क्लिनिकल पैथोलॉजी भी करेगा, और क्लिनिकल माइक्रोबायोलॉजी भी करेगा, और इसके अलावा क्वालिटी कंट्रोल में भी हेल्प करेगा, मेडिकल ऑडिट्स भी कर पाएगा. ओके, सो दे वांटेड टू मेक दिस ब्रांच व्हिच वाज एक्चुअली जैक ऑफ ऑल ट्रेड्स, उसको करके लैब मेडिसिन बनाई. एंड दिस पर्सन इज आल्सो ट्रेन्ड वेल इनफ. सपोज ही इज लुकिंग एट द हेमेटोलॉजी स्लाइड एंड ही इज सीइंग कि ये ल्यूकीमिया है. बाय द टाइम यू आर ट्रेन्ड इनफ टू आइडेंटिफाई दिस इज ल्यूकीमिया, देन यू कैन रेफर दिस केस टू super specialization, send him to hematology department. अगर आपने similarly microbiology में भी if you look at some case and you find it कि अच्छा इसमें ये problem है, then you send it to the specialized microbiology department. So lab medicine is just an initiator, the first part of the hospital. People who are trained enough to see everything, clinical biochemistry, hematology, and microbiology, and also part of lab quality controls. And then they will send it further to the specialized. They will not do histopathology. Histopath नहीं करेंगे वो, ठीक है. वो सिर्फ देखेंगे रिपोर्ट को, ब्लड की रिपोर्ट को देख के बोलेंगे अच्छा ये इसमें ये स्पेशलाइजेशन की जरूरत है, इसमें ये है माइक्रोसिटिक हाइपोक्रोमिक एनीमिया, टू फर्दर वर्कअप सेंड टू हेमेटोलॉजी, लाइक दैट. So
Right.
it's like the initiator part of everything.
Right. So basically, they are the people who screen things and then channelize it to wherever required.
Absolutely, that's the perfect way of putting it. They screen and they channelize to the super specialist, to the particular person. So it's basically one job, one profile which has been made by AIMS, and it is recognized by MCI though. But most of the corporate hospitals prefer to take lab medicine people, because they are actually the screeners, the first person who can, run the who can just once the tests are run, they can just screen it and then send it to the super specialists.
Right. Okay. Ma'am, how about lifestyle and this very pertinent question, uh, lifestyle and monetary aspects in government versus and owning our own lab.
देखिए, ये तो क्वेश्चन ही नहीं हुआ. Owning your lab, you are like, there's no limit. You can reach like Ambani's. You can become rich, one of the richest person of the your own what do you say, state. So Lal Pathology person is a very rich person, or any lab chain if you're looking at, and if they have done it nicely, they are one of the richest people in the country, I would say. So definitely, when you talk about opening your own lab, it is actually business. Okay, so you are becoming a business person. It
Right.
is total business. So you can be successful in business, you can be a failure in business. It depends upon your business skills. Okay, so opening your own lab is totally a business thing. Okay, uh, now in government setup has their own pay, fixed pay, which comes up like it is about 1.5 to 2 lakhs a month. To start with 1 lakh, it can go up to 2 lakhs per month in a government setup. And of course, government setup has a relatively like 9 to 5 kind of a job for pathologist. And usually they it's not a very for any branch, let's say, it's not a very hectic kind of a branch. Pathology, not in residency, I'm saying residency is very hectic. Okay, path residency is one of the very hectic residency, because you have to finish the amount of cases that have come to you, and there is a turnaround time. Now that time you have to give the reports in time, so you have to do it from like path residency, from it can go from morning 9 to night 9, or even beyond that. Residency staff. But when I'm talking about consultancy, once you are working in a government setup, it's like 9 to 5 job usually for a pathologist. Whereas in a corporate setup, when you're talking about, if you're joining a job in a corporate setup, again it is same only, 9 to 5, 9 to 6, it will be a job like that. But if you're opening your own lab, then sky is the limit. It's your own business, you have to run it. You can be as successful in running your business as much hard work you put.
Right. So for all those entrepreneurs out there, uh, starting your own lab might be a good option. So, ma'am, this makes me to this very pertinent question. This rampant practice of infiltration by other people from other fields regarding this signature in the reports. How to uh, how to go about with this, and what's the uh, how to what's your take on this?
See, this is actually not a good practice. Giving signatures, okay, it is actually not a ethical practice to do. See, if you give your signature to any lab, okay, what is going to happen is that any technician is going to run the tests, and it's going to put your signatures on the report, and the report is going to go out of your name, with your name. See, after a point of time, you'll realize when you become senior, okay, your name starts carrying a value. Okay, your name will carry a value. It is not that you will be a no one. You will definitely have a name value that will come. In whichever city you work, you will have a name value which will become. So when you're beginning to do to start your career and you're not getting a job, you will think that अच्छा यार दे देते हैं अपना नाम दे देते हैं तो क्या मेरे को ये for 1 hour he will give me 10,000 or 20,000 rupees. Okay, I'm just getting it and he'll put my sign and give the report. So you'll think like that, but it has a repercussion which will come later on. When you become senior, it basically spoils your name, and it is not good also, it's not ethical also. I'll tell you a case, okay, that you will be able to relate to. There was a report which came to us from for review from somewhere in Chhattisgarh, and this was one of I knew this person, one of the person, and his name was there in that report. A stamp was there, and it was signed as acute leukemia. And the child was brought to us for saying that slide has to be sent for review. So when I reviewed the slide, I just saw it was not at all a leukemia. It was actually a neutrophilic leukocytosis, basically, and there was no abnormal cells or blast. Okay, but the counts were very high. Okay, counts were very high, like 50,000 ke kareeb count tha, and lot of neutrophils were there, and there was shift also to the left also, like leukemoid reaction type keh sakte ho aap. So then I knew that person somehow, and I called and I said कि अच्छा ये acute leukemia करके तुमने sign करी हुई है report, acute leukemia तो है नहीं क्या? ऐसा तो नहीं था कि leukemia था और किसी ने steroid दे दिए तो वो blast गायब हो गए, तो इसीलिए हमारे पास आया है. अभी हमारे पास आया तो ब्लास्ट नहीं है. तो आई स्टिल रिलाइड ऑन दैट पर्सन कि हो सकता है कि उसने सही रिपोर्ट दी होगी, बट हो सकता है किसी ने स्टेरॉइड बीच में दे दिए तो ब्लास्ट कम हो गए हैं. तो आई कॉल्ड जस्ट टू आस्क दैट पर्सन कि ऐसा हुआ, तो मैम मैंने तो ऐसी रिपोर्ट कभी साइन ही नहीं करी है. एंड आई सेड कि देन आई सेंड हिम द कॉपी ऑफ द रिपोर्ट कि देखो ये रिपोर्ट है एंड जस्ट लुक एट इट. सो ही इमीडिएटली कॉल्स मी कि मैम थैंक यू, आपने मुझे बताया. एक्चुअली ये मैंने मतलब 3-4 साल पहले अपने साइन किसी लैब को दिए थे, एंड आई डिडंट इवन न्यू दैट दे आर स्टिल यूजिंग दैट साइन. मैंने वो हटा दिया था उनको बोल के कि आई हैव नाउ जॉइन्ड जॉब समवेयर एल्स, प्लीज डोंट यूज माय साइन, बट दे आर स्टिल यूजिंग इट. थैंक यू फॉर सेंडिंग द रिपोर्ट टू मी. So that report was actually not given by him. Some lab technician would have seen that and put the stamp of this person and sent. Imagine his report is going out as acute leukemia from that pathologist. कल को कोई sue कर दे या कोई case लगा दे कि आपने acute leukemia लगाया, भगवान ना करे कि उस patient को chemotherapy start हो जाती, तो क्या होता? It would have been, very bad. So basically, somehow he went and he sorted that issue. I don't know how he sorted, but that was an issue. So once you give your sign to somebody, you don't know till when they are going to use it and how you're going to stop it. Because unke paas to hai. You're not going to snatch it away, or as a doctor, we are not criminals. We are not goons. कि भैया मेरा sign अगर दोबारा use किया ना तो तेरी पिटाई होगी. ऐसे तो नहीं कर सकते ना. So it's like so the ethics goes down, and the your credentials also are used rampantly. आपको पता भी नहीं होगा कि आपका नाम कोई यूज कर रहा है, और आप इवन बोल देते हो कि मेरा मत यूज करना, and still if they are using, you can't do anything about it. It's very dangerous. Actually, you should not do it. It's very dangerous. You don't understand the importance of it until and unless you fall into the trap of it. So never you should do it.
Right. All of us can understand how grave the case was. Ma'am, one word for motivation, a concluding message for the students, budding pathologists.
Yeah. So I would only say that pathology is a very good branch. Actually, first thing that you should do after taking pathology is you should start loving your branch. Again, मैं तुम्हें यहाँ पे केस बताऊंगी, केस नहीं मतलब एक किस्सा बताऊंगी before concluding.
Yeah.
When I joined as a first year resident, I had a senior resident who was posted with me. I was posted in histopath grossing room. Okay, grossing is one area of the pathology where you feel you'll get that colon आएगा तुम्हारे पास, उसके अंदर ना पूरा it was dirty, गंदा, and you have to wash it and you have to cut it. Okay, उसके बाद जब आपके पास as a first year resident you posted, then यार ये मैं क्या कर रहा हूँ यार, ये मैं कहाँ आ गया हूँ यार, ये क्या हो गया यार, मैं तो ऐसा मैंने सोचा नहीं था कि मैं ऐसी ब्रांच में आ जाऊंगा. And there's formalin everywhere, तुम्हारी आंखों में भी formalin जा रही है. And then I said, क्या सर, he was a sir. I said, क्या सर ये क्या है सर, मैंने तो नहीं सोचा था पैथोलॉजी ऐसी होगी, ऐसा ये सब करना पड़ रहा है. तो he said, किसने बोला था तुम्हें पैथोलॉजी लेने के लिए, बोला किसने था, क्यों लिया पैथोलॉजी बताओ. He was from Bihar, so he used to talk. किसने बोला था लेने के लिए, बताइए लिया ही क्यों तुमने, किसने बोला था, कहाँ से सीखा तुम. तो I was like गलती कर दी क्या सर, बताइए ना, मुझे समझ नहीं आ रहा, क्या गलती कर दी क्या सर? और क्या, अब तो कर दी है गलती, अब क्या करोगे, अब तो कर दी, अब तो करना पड़ेगा ये सब, अब तो करना ही पड़ेगा ये सब. एंड आई वाज एक्चुअली थिंकिंग दैट डे कमिंग बैक, यार गलती तो नहीं कर दी यार, व्हाट आई एम डूइंग. दैट सर वाज सेइंग कि गलती कर दी तुमने, मतलब वो तो सीनियर रेसिडेंट थे, वही अपने सब्जेक्ट को अच्छा नहीं कह रहे, बताओ यार गलती तो नहीं कर दी. आई लिटरली क्राइड दैट डे, यार गलती कर दी यार, पापा सही बोलते थे, गायनी ले लेनी चाहिए थी, बहुत गलती हो गई, भारी गलती हो गई. I was literally going to cry that day ना. फिर उसके बाद मैंने अपने आप को समझाया, नहीं नहीं ना, कोई बात नहीं, let's see. So that's one thing I would say, your seniors make a lot of impact. So as a pathologist, you should love the branch. अगर वही senior resident मुझे बोलता है, क्या यार इसमें क्या है यार, एक दो दिन में आदत पड़ जाएगी, इसमें क्या है, sections ही तो लेने हैं, इसको काट यहाँ से वॉश कर sections ले, क्या प्रॉब्लम है इसमें क्यों नहीं, क्या बात है, 2 मिनट का काम है, खत्म करते हैं. तो that would have been different rather than a senior resident saying me, तुम पागल हो क्या ले लिए ब्रांच, किसने कहा था लेने के लिए. So मतलब it was like so once you take pathology, actually you should continue with pathology only if you love the branch. If you yourself don't love the branch, you should not actually take it. And at least people who are joining under you, they are in a dilemma themselves कि यार pathology ले ली. Some of them would have taken by choice, some of them would have taken कुछ और मिल नहीं रहा था यार, इसलिए ले लिया pathology. तो at least you should try to develop love for pathology in everybody's eyes, because definitely this is one subject people don't know about. So if somebody comes and says, you क्यों ले लिया यार, पागल हो क्या, तो you will feel like, अरे यार गलती हो गई है. So you should not do that. So if you're taking pathology and you're loving it, do love it, love your branch, you're going to live with that branch. And if suppose you don't love the branch, okay, quit it. Don't take it, because you're going to live with that. I still remember one of the girl messaging me yesterday. If she will hear this interview, she'll remember that she has done ophthalmology from AIIMS New Delhi. Okay, one of the best institutes, okay, of ophthalmology. She's done, and she messages me a few days back. मैम ये बताइए ना कि आपकी बुक अभी भी आ रही है क्या. मैंने बोला भाई शी आस्क मी, बोला क्यों, क्या हुआ. शी सेड कि मुझे ना दोबारा तैयारी करनी है. मैंने बोला अरे चलो तो ऑप्थाल करिए अभी, तो वो भी राजेंद्र प्रसाद से करिए ना. So she said, ma'am, I'm not liking the branch. I'm thinking of giving NEET again and, taking some other branch. So it's like, it's not that every branch is meant for you. So think, once you have chosen a branch, think whether you love or you don't love it. If you don't love it, leave it and definitely take another branch. But if you've taken a branch, love your branch. Okay, because that branch is going to stay with you forever. And if you love it, sky is the limit, guys. There's no stopping. यहाँ पे तुम कुछ भी करो, तुम कोई भी सब्जेक्ट लो, you can do wonders. I remember one of my batchmates was pharmacologist and senior residency में he joined Novartis and he's always traveling now. Okay, so I'm always asking me कहाँ है, अभी तो मैं जर्मनी में हूँ, फिर where are you, अभी तो मैं यूके में हूँ. क्या यार क्या है, हाँ मैं बस जिंदगी के मजे उठा रहा हूँ. So it's like every branch has its own pros and cons, but you should love your branch and you will do wonders in it.
Right. So guys, what I would want to tell you is that ma'am knew her calling and she went for it, and therefore today we got such an inspirational teacher who is respected across the country. And ma'am, it's an honor to have been able to talk with you today. Thanks a lot, ma'am, and looking forward to see you again. And and ma'am, thanks a lot.
Thanks for calling me also. I must tell you, Dwit and Dharya, thank you for calling me also.
Thanks a lot. Okay, so guys, we'll come back again, replenished, rejuvenated, bright and clear. Till then, stay tuned. Okay, have a nice day. Bye bye.